At this year's 13th BGICC 2021, I will be talking about preoperative breast MRI staging and how it has evolved in the past decades. We will be briefly talking about the TNM staging, evolution of breast cancer treatment in terms of surgical approaches, and how things have changed in the past few decades, not only because of improved adjuvant treatments and neoadjuvant treatments, but also revolutionary changes that has happened in breast imaging as such, and more importantly for breast MRI, which plays a very key role in staging of breast cancer at the current times. There is increased utilization of breast MRI all over the world, and it is important to assess the exact indications in which this could be offered to women. The few questions that I will be talking about in this presentation is, does preoperative MRI really change surgical treatment? Does it change the amount of surgery? Is it more extensive surgery versus breast conservation? Is utilization of MRI leading to increase or decrease in mastectomy rates? Because ultimately, the use of any modality is supposed to provide minimal intervention, minimal excision. What is the effect of breast MRI on re-excision rates? Has it really changed the amount of re-excision? And of course, what is the long-term benefit of utilization of preoperative breast MRI, such as long-term benefits in terms of, is there a mortality benefit? Is there a decrease in the in-breast local recurrence, or is there reduction in distant recurrences because we used preoperative staging? And then, of course, the more important aspect is the cost of intervention, and the delays in treatment. I will be touching upon controversies that exist with preoperative MRI, and the more important understanding would be that as we go through the talk is basically preoperative MRI does not show mortality benefit amongst women with breast cancer, so it has to be utilized in a very appropriate manner. It has not shown to improve surgical outcomes or diminish breast cancer specific mortality. And its role may more be qualitative in providing information to women and the referring surgeons and clinicians to demonstrate the true extent and absence of additional breast cancer. So it is important that we understand that breast MRI should be used targeted to individual groups of women in whom the benefit would be maximum, such as women with invasive lobular breast cancers, women who are high risk. There is some personal or family history. The lifetime risk is more than 20 to 25%. So there are many specific indications where breast MRI will prove to be useful. It is very important to understand that patient-centered outcomes are important in deciding in whom preoperative breast MRI can be utilized, and also how is this decision of performing breast MRI staging affect surgical choices as well as women's preferences. So just to summarize in this talk, we will try to provide a balanced view towards MRI utilization. Any use of MRI for preoperative staging has to be personalized in individual specific high-risk groups or a specific history within the woman in whom this can be offered. We want to encourage evidence-based use. And of course, we need to understand that this is the use of MRI is very beneficial in places where there is no dedicated breast surgeon or more general surgeons who are operating on breast. But at a center which is focused on breast cancer treatment, this has to be, the breast MRI staging has to be tailored to specific groups. So I hope this gives you an overview of what I will be discussing in this talk. Thank you.